apps for psychological ED. Do they work? The research results might surprise you. In this series of quick videos, I'm reviewing the psychological ED treatments so you can decide what approach is going to be right for you. Today, we're looking at the apps. So let's dive right into the research and how using an app might help you resolve your mental ED.
Boring.
And if you think hearing about research is boring, stick with me. Some of these results blew my mind. The first study we'll talk about is from the Archivio Italiano di Urologia e Andrologia. They looked at 18 apps across the iPhone, Android spectrum and concluded the overall quality is still low. Although many of these devices are useful in ED, the problems of scientific validation, content, and quality are not yet solved. Okay, so that sounds like some opinion there. They didn't actually test them on guys to see if they work to solve the ED problem. Good to hear that they think they can be useful, but I'm not too sure you'd be able to make much of a decision either way on that study. Next, another Italian study compared apps to social media and the web as a way to address the problem that most guys with psychological ED are too embarrassed to seek help. The apps won. They concluded apps are the most complete and trustworthy tool for self-care management. Then a German study looked at an app that coached guys across the spectrum of ED-related areas. Background knowledge about ED, pelvic floor training, cardiovascular training, mindfulness, sexual therapy exercises. 44 guys, 12 weeks, and the conclusion, 96% of patients showed overall improvement of erection scores. We concluded that it is possible to reproduce the results of analog studies in a digital setting. Boom. That's a game changer. They're getting results as good as working with a live therapist just with an app. This really surprised me, and in the best way possible. And here's another German study that sounds even better. They tested their app with 241 guys. The conclusion, app-based therapy of patients with ED provided a significant clinically meaningful improvement. Quality of life and patient activation were also enhanced significantly. This program has the potential to change the clinical practice in the treatment of ED. Damn. True, not every guy in these studies had ED that was strictly psychological. Also true that it's not really clear what app they used. In one study, it sounds like they created it themselves. The other, it wasn't clear if it was a commercial app available to the public or not. So far as I can tell, unfortunately, you can't just go out and get one of these apps. One of them sounds a lot like Mojo, though, if you ever heard of the Mojo app for guys with psychological ED. But again, it's not really clear. My opinion about apps as a psychological ED cure? I think this is amazing. Okay, so now we have solid research showing that you can solve a mental ED problem without having to deal with going into any kind of therapy or taking meds. Apps are easy to get, you can start right away, and most of them are pretty cheap. That said, maybe I'm old-fashioned. I'm always going to say that working with a skilled, real-life person is the best choice for anyone who has that option. And I've talked to guys who failed with apps and succeeded in working with me for sure. But with studies like these, it would be hard not to say that apps are a good bet. Oh, and if you're wondering, who cares what this guy thinks? Fair question. I'm not a doctor or a psychologist, but with over 20 years of experience helping guys resolve ED with hypnosis and coaching, I've seen a lot of different ways guys can get their confidence and their sex lives back. So that's it. Again, I'm Brian Mahoney with psychologicaled.com. If you ever want to talk about working together, just give me a call or drop me a note. And if you decide to try an app as an ED cure at any point, I hope you choose one that helps you get into a really healthy, happy, fun sex life again. Thanks for watching.